Good morning, everyone. My name is Karen Hughes, and I'm the president and CEO of Vogel Alcove, but I also serve as the board chair for MDHA. So as board chair, I would like to welcome everyone to the 2019 State of the Homeless Address. MDHA as an organization is honored to be able to host this annual event for the city each and every year. I would like to ask my fellow board members, if you're in the audience and you're a board member of MDHA, would you please stand and be recognized? And also the extremely very committed staff of MDHA. They're probably out and about doing things, but if you're in this room, would you please wave or stand up, please? This morning's presentation will highlight the current state of homelessness in Dallas and how well our continuum of care is actually functioning in order to end homelessness in the Dallas area. The foundation of the continuum of care are the homeless service providers who provide services to our homeless neighbors each and every day. If you are an executive, a staff member, or board member of one of the service providers in the continuum of care, will you please stand and be acknowledged? At this time, I would also like to take a moment to do a special recognition for the City of Dallas Office of Homeless Solutions and their strong support of MDHA. I was delighted the other night to see the Assistant City Manager, Nadia Chandler Hardy, and her members of her staff checking in volunteers at First United Methodist Church on the night of the count, while members of the OHS Street Outreach team were out counting the homeless. Our partnership with the city extends well beyond the annual point-in-time count. I am excited about the future of the Office of Homeless Solutions in MDHA as we work together on behalf of the neighbors experiencing homelessness, because the answer to homelessness is a home. Nadia, will you and your staff please stand and be recognized? As they say many times, it takes a village, so we have other partners in this work that we'd like to recognize as well. Our other partners in this work include the Citizens Homeless Commission and the Dallas Area Partnership. So if you are a member of either one of those bodies, would you please stand and be recognized? This work is not possible with the nonprofit sector and alone. It requires the support and commitment from our elected officials. MDHA would like to personally thank Mayor Mike Rollins for his terrific support of our organization through his term and his commitment to the issue of homelessness. Thank you, Mayor, for all you have done for our city and helping to end homelessness in Dallas. I would also like to take this opportunity to recognize any other of our elected officials, both city and county, that may be in the audience. If you're in the audience, would you please stand? Well, it's springtime in Dallas, we hope, and with spring comes changes at City Hall most of the time. So with new elections right around the corner, if you are a mayoral candidate or a city council candidate, would you please stand and be recognized? I believe the presentation today will show us the progress that we have made, but it will also show us the work that is yet to be done. But in order to meet this challenge, it will take all of us working together. MDHA is pleased to have all of you as partners in this very important work. And now it gives me great pleasure to introduce the President and CEO of MDHA, Carl Faulkner.
Thank you, everybody. Before I start, I have to keep the suspense going, right? Everybody's waiting for that big number or that small number. What I'd like to do first is I'd like to give one of our presenting sponsors an opportunity to say a few words. Kelly Hanley is here on behalf of Wells Fargo. Thank you.
Good morning, everyone. Thank you all for being here. This is so amazing to see so many people here together for such an important cause for our area. At Wells Fargo, we're proud to sponsor this event this year. It's part of our commitment in joining other organizations here working across the housing spectrum and trying to solve homelessness here. This kind of financial and volunteer commitment is driven by Wells Fargo's culture of caring and our belief that our communities are stronger when affordable housing is available for all. In addition, Wells Fargo is committed to supporting long-term economic growth and enabling the development of more affordable housing options to improve the quality of life for everyone in our communities. But our efforts don't stop there. Last year alone, Wells Fargo donated more than $12.1 million to nonprofits and schools in the state of Texas. And our team members volunteered more than 139,000 hours to support a vast variety of causes, including tackling food insecurity, providing financial literacy, and ultimately making sure our communities succeed. We believe strongly in the positive impact that what we're doing can deliver for individuals, families, communities, and for our nation as a whole. However, we also know we need to address these challenges together. That's why we're happy to work with our partners such as MDHA, stakeholders, policymakers, regulators, to ensure that we do our part to lead the conversation and to achieve the right outcomes. We strongly believe in the work MDHA is doing, and we are proud to be your partner in efforts to help make homelessness rare, brief, and non-recurring by housing those experiencing homelessness and helping them move forward. On behalf of Wells Fargo, I thank everyone in this room for your contributions to our community, and I hope that you enjoy this program today. Thank you.
Thank you. All right, I'm going to try the switch over now to the other mic and see if this works. Can everyone hear me? Can everyone hear me? Yes? Yes? Okay, great. Oh, sorry, wrong way. MDHA, let me tell you a little about MDHA first, and then we'll get right into the presentation. As has already been said, my name is Carl Falconer. I am the CEO and president of MDHA. I've been here an entirety of almost 4 months now here in the Dallas Metroplex area. So probably a little shorter than most of you here. And I'm happy to be here. I really feel welcomed here, and I feel like we have a real opportunity here to make real progress towards ending homelessness. It's one of the reasons why I came. Our mission at MDHA is to lead the development of an effective homeless response system that will make the experience of homelessness in Dallas and Collin counties rare, brief, and non-recurring. Our vision is very simple. It's to end homelessness and be the best continuum of care in the country. Can't get more simple than that, right? All right. The purpose of our presentation today, or the State of the Homeless Address, is to collectively review data, to give an honest assessment of our system, to inform our decisions with data, and to welcome ideas and insights that will help make homelessness rare, brief, and non-recurring. And now, to the numbers, what you've all been waiting for, right? Somebody have a drum roll or something? No, okay. No drum roll. All right, let's get right into it. The first part of the presentation that I'm giving is really the numbers. I'll be giving you a lot of numbers and a lot of information here. The slides will be available later, so you don't have to snap every shot of every slide that's up here. They will be available later for anyone who needs them. And then after that, then we'll talk about strategies and where we go from here. The point in time count. These are the numbers for 2019. You'll notice there are a couple of glaring issues here. Number one, a rise in emergency sheltered homelessness by 16%. A rise in unsheltered homelessness by 8%. And an overall rise by another 9% from 2018 to 2019. Our methodology that we use for the unsheltered portion of the point in time count, we counted, the count was conducted on Thursday, January 24th at approximately 8:30 p.m. And for those of you that were there, you realize that the temperatures were in fact in the 40s that evening. It was quite cold. We had continued improvement in the coverage area with well over 1,550 volunteers. And I want to say thank you to everyone that volunteered on that evening. That was a massive undertaking, and quite frankly, from my own experience, it's the largest point in time count of volunteers that I've ever seen. We use the Counting Us Smart device app to do GPS mapping and surveying. We also did GIS generated maps for volunteer assignments and documented coverage areas to ensure that we covered all of Dallas and Collin counties. And then we took in the data, we analyzed it, and we deduplicated it. These are the results of the unsheltered survey data source. We had 730 interviews and 722 observations. And again, I want to say thank you to our volunteers for doing as many interviews. It's easy to go out and drive around on the streets and stay warm in your car. It's harder to get out and actually talk to people and find out what their needs are and interact with them and touch them, hold their hands, care for them, let them know that they are cared about as human beings. That's the harder part when you do the point in time count. But I appreciate the effort that everybody made towards that. The methodology for the sheltered homeless count, the HMIS system reports for 12 emergency shelter, safe haven, and transitional housing agencies. We again use the Counting Us Excel template for 29 non-HMIS user agencies and domestic violence providers. And then we do the deduplication of analysis against other sheltered data and unsheltered data. Nationally, what it looks like in December 2018, HUD put out an annual homeless assessment report, and what they reported was that homelessness has increased nationally for a second year in a row. So apparently on the national scale, we're moving in the wrong direction still. But they also reported there was only a 3% increase in unsheltered homelessness, as opposed to our 8% increase in the Dallas and Collin County areas. There were increases in the numbers of unsheltered, and that actually accounted for the overall increase in homelessness nationally, was that 3%. Unsheltered homeless by city in Dallas County. This is where we start to drill down into the numbers a little bit, and this is where it starts to get interesting, particularly for those of you who live in the outer cities around the Dallas Metroplex. Okay, you'll start to recognize that there are names on here that were not here previously. What that tells us is that homelessness is expanding. It's moving to other areas where we could not find, or there were not homeless people previously. That's what happens when a homeless population gets out of control and when your service system is not working to house people. But you'll notice on here some of the bigger jumps. We had a 54-person change in Dallas, 19 in Grand Prairie. And again, if you look at the numbers for Grand Prairie or the numbers for Garland, you see that they're not very big. But when you look at how big the numbers are and their increases, you can see that something's going on there. Okay? Something's happening in those areas that we have to try to understand. And that's why we do these counts. That's why we get this information. But look at places like Irving. And I want to give credit to Irving. They went down in their homeless count for the unsheltered homeless in their city. And I've talked with people at the city of Irving, and they seem to know what they're doing out there. They actually have really good services in place for what they're trying to do. And then the last one that I want to point out here is Carrollton, which last year counted 0 and this year counted 14 homeless individuals. So as you can see, it's starting to spread out, not just in the downtown areas of Dallas or the major metropolitan areas of Collin County. Let's go to Collin County here. You'll notice in Collin County, and I want to give credit to anyone that's here as a service provider from Collin County, because if you look at the bottom line numbers here for the unsheltered homeless, they actually went down. You know why? They're doing things. They're doing things. They're providing services. They're trying to get ahead of it. Even though the number last year was only 116, they're trying to put things in place so that things like this in McKinney will go down. Numbers in Plano will go down. You see where they're making an impact. Okay. The gender of unsheltered homeless, this is for the entire population. Again, it remained right at 78% of men and 21% women. Okay. The ages of the unsheltered, you'll notice here that these were the largest gains in the age range, 274, 371. You'll notice the gains that went up here for the ages of the unsheltered. This is, unlike last year, our gains were primarily in this area. So you can see that the population is getting younger of homeless individuals that are out on the streets. The race of unsheltered actually changed significantly. This year it's almost a 50-50 split between white and black. Length of time homeless. This continues to go down. Homeless over 1 year, 36%. And first-time homeless, 230, down from the 277, even though it was up from the 208. But if you look at some of these average lengths of stay for homeless unsheltered, 3 years and 4 months somebody's been out on the streets. That's an average. Okay, that's way too long. Way too long. Households with children at the point in time count. We have 313 total households with adults and children. 1,025 people were counted in families. And 732 total homeless children, which is 16% of the homeless population are children under the age of 18. And most people don't think of it when they think of homelessness as children that are out there homeless. I want to give credit to Carrie Stitt with Promise House, who supplied these slides for us. They did a youth count that was separate from our point in time count. They counted 181 youth that were unaccompanied. You can see what the statistics look like here. Female versus male, black or African American versus white. The source of this, I also want to give credit to Rachel Johns and the SMU core team who conducted the analysis and put it together. And here's a little bit deeper drill down on the point in time count for youth specifically. You'll notice a couple of things here. 70% of the youth that were surveyed plan to return to school. They're trying to get there. 63% had family or friend dynamics. That was their factor contributing to homelessness. And if you look at what their needs and barriers are, 79% of them have a need for a state ID, Social Security card, or birth certificate. Do you know how hard it is to get housed if you don't have a birth certificate or an ID? It's almost impossible. I also want to give credit to Ellen Magnus. I saw Ellen earlier with Family Gateway, who provided these slides on families specifically. And what we're pointing out here is the calls to the Homeless Crisis Helpline, which option 3 goes specifically to families and goes specifically to Family Gateway. And so what they did is they tracked it. If you notice where we started, the Homeless Crisis Helpline right here, these are the numbers, went up and then kind of leveled out at what Ellen calls her new norm, 550 or so calls per month that they're getting from families who need shelter or who need assistance. Let's look at breakdown a little bit. There were 4,800 calls in 2018 that they took. 1,400 needed help immediately, and 3,400 were pre-screened to determine urgency or eligibility of service needs. 60% of them, or approximately 2,000 families, met the HUD definition of homeless or imminently homeless, which means they were legitimately homeless, okay, without a place to stay. If you break it down a little bit more, 40% of the people did not meet eligibility, and then this is the 60% that she was talking about, living in an uninhabitable condition, living in hotels, imminently homeless, or this is the other one that's troubling too. They were in another shelter and they were getting ready to have to leave that shelter, okay, which was going to put them back into homelessness. Right? 1,600, they did 1,600 face-to-face assessments, and the real important thing that I want to point out here is that they diverted 900 people, or approximately 900 families, from shelter by working through reunification, temporary solutions, eviction remediation. They worked through this online with people, and this was 900 families that did not have to come into their shelter. We should be doing more of this in our community, okay? There are lots of people who have options where to go. And what they did through this process, and very successfully I would add, is they found out what those options were and they helped them work through those options, right? For homeless veterans, again we see an increase from the previous year. The number of homeless veterans this year we counted was 431, with 84 of them being chronically homeless. And you'll see that the total number of homeless individuals who are veterans in 2019 is 11.3%. 100 more than last year. There should be no reason that there should be veteran homelessness here. Okay? It's one of the few populations where we know that we have resources available for them. We've got to figure out what's happening here and what's going on so that we can help them. Chronically homeless. This is the definition for those of you that are not familiar with it. It means you're homeless at least a year, you have accumulated time homeless at least a year in the last 3 years, or you possess a documented disabling condition. The point in time count showed us that there were 470 people that were identified as chronically homeless, up again from 424. That's an 11% increase in chronic homelessness this year. Okay, does anybody see a trend? We see a trend. Larry, you see a trend with some of this data? It seems to be moving in the wrong direction. And I'm sorry to have to be the one to bear the bad news. Please hold your fruit, at least until the end. But I want to give you a real snapshot. That's what this is about. This is about telling us, letting everybody know what the real information is. Chronically homeless, the coordinated access system and documentation of priority status has the chronic homeless received the highest priority. In 2018, we actually verified and prioritized 199 chronically homeless individuals through our coordinated access system. The housing priority list, it's one of the most important tools that we have. It's updated weekly. Homeless people are added to the list. It helps us develop a housing strategy, and homeless persons are housed or exited and come off of the list. So if we look at the numbers, this is our housing priority tracker list for the last year. So this is what it looked like over the year. These are the numbers as you go month by month. And when you get to the end, this population of people is a P9 to P10, okay? And what that means is they are the lowest priority in terms of a non-disabling condition or have been on the streets the longest. They have not. And that'll come into play later when we show you what the system analysis showed us, okay? Hold on. The housing priority list, again, the top of the list, middle of the list, and bottom of the list, and you can see who all fits into those different categories, and it organizes the housing needs and gaps. Documentation of priority status, there were 1,025 people who were assessed by MDHA, and 559 of them confirmed house from the housing priority list in the last 12 months. 357 of them went to permanent housing destinations within the COC. And what this tells us is that we are housing people. Okay, we are housing people. There is housing out there. Somebody's going to this housing. We are finding some housing. The question is how much and how do we break it out? This is a snapshot of the housing need. So this is based off of last year's statistics of all the people that came through the housing priority list. As you will see, the oldest or the average age is 51 years old for somebody who in the P1 through 4 category. Oldest was 77, the youngest was 25. Their average income was $371 a month. Anyone here know where you can live for $371 a month? Anybody? No? Okay. Didn't think so. If you look at the P5 through 8, which is our middle category of prioritization, their average income is $301 a month. And then if you go down to the moderately low or severe, P9 to 10, their average income is $143 a month. Now these are people who are not disabled, who should be able to be employed, who want to be employed, and I'll show you a slide on that later. But yet, they still are making the least amount of money in our system. We've got to figure out a way to change that. Now we get to the analysis and the performance. This will take a little more explanation. So, the MC Needs Assessment, Housing Needs Assessment, is actually an assessment tool that myself and a friend of mine, a staff person of mine, Michael Blessing, actually put together. We developed it based off of national standards for what people were seeing as far as where housing should be divided in terms of capacity, in terms of number of beds in your community. We used that. We plugged in numbers from the point-in-time count and our housing inventory chart, and this is what it showed us. This is where our current capacity is. These are how many beds we have right now in each of these. For those of you that are HUD COC people, these two are lumped together as PSH because HUD does not consider long-term rapid rehousing permanent supportive housing, even though that's technically what they fund, is long-term rapid rehousing. But as you can see, we have 2,621 beds in emergency shelter, and honestly, I think that actually might be a little bit low. Any system analysis that you do is going to have flaws and it's going to have gaps. I think we're pretty accurate with the number here, but I still think that there are some emergency shelter beds that we were not able to count. But as you can see, what this means is that, now this is a snapshot. So in this housing assessment, what it says is if you had 1 year to end homelessness, here is what you would need in each category in order to end it in 1 year. So it's not meant to say, okay, go out and get 4,000 units of short-term rapid rehousing. What it's meant to say is it's meant to say you should be able to add short-term rapid rehousing to your system, and then it will change what the numbers look like from year to year, hopefully going down. Again, remember going back to the age of the population that we're working with and who was the most significant increase, the 25 to 44-year-olds. a lot of the people in that category need this kind of housing. And right now we have 358 beds available in our entire system for rapid rehousing. That one I'm pretty sure we're pretty accurate on, because we're one of the few funding sources that actually fund rapid rehousing. But if you see where the gap is, 4,005 beds if we wanted to end homelessness in 1 year. But that's a huge gap. In terms of emergency shelter, there isn't a gap. And the reason is because if we ran emergency shelter efficiently, or we ran emergency shelter at the highest level, and that's what this assessment tool assumes, is that you'll run it at the highest level, then technically we would be able to serve over 31,000 people, individuals, separate individuals, in 1 year with the amount of emergency shelter beds that we have. 31,000. Because in a perfect world, in a perfect system, people would only stay in emergency shelter 30 days. That's what emergency shelter is for. They get in, they move out. They get in, they move out. They get in, they move out. I don't think that's what we're seeing. Okay. Bed allocation assessment. This is another assessment that we did based off of our current bed allocation. And we just ran straight numbers for this. What is the bed allocation that we have in our system? Okay? And we look at it, emergency shelter, 42% of the beds, transitional housing, 16%, short-term rapid rehousing right now is 6% of our total allocation. And when you look nationally at what the national models say, what they say is we should be somewhere closer to 43%. There's a pretty big gap there, I would say. When you look at the others, 25% here total, 37%, that's pretty close. We're a little bit higher in emergency shelter and a little bit lower in transitional housing, but those aren't as significant as 37% lower than what our rapid rehousing units should be, or beds should be. Okay. And then finally we get to the money. Where are we spending the money? So we did an analysis and we asked our providers and we asked agencies, where are they spending their dollars? What systems and what components are they spending their money on? And this is what we came up with. Right now, 49% of our current system spending or thereabout is in emergency shelter. 15% is in transitional housing. 4% is in short-term rapid rehousing. And then 25% or so is in this long-term rapid rehousing, permanent supportive housing. Okay? This is the one, again, these are the two that stand out. Now, don't get me wrong. Anybody in the press getting ready to write this down, don't say that Carl said we should not have emergency shelter beds or we should have less. That's not what I'm saying. All right? What I'm saying is emergency shelter is expensive. And it might very well be that 49% is where we need to be in terms of emergency shelter beds and spending. But short-term rapid rehousing, of all of the components up here, this is the least expensive. And we're only spending 4% of our money there. In the banking world, they call that a very poor return on investment. Okay? We have 49% of our spending going into a place where people can't get out. People can't move on. People are staying homeless. When you move somebody into a unit in short-term rapid rehousing, you immediately cause them to not be homeless any longer. My son, and some of y'all may have seen the slide that I had running earlier before the show started. My son said to me at the bright old age of 5 years old, I asked him, what's the difference between somebody who's out there on the street homeless and us? And he said, well, housing. What else? We have a place to go and they don't. I said, now that's a smart 5-year-old right there. Okay, that was 20 years ago. And it still hasn't changed. There's no difference between the people on the streets and us, other than the housing. All right? They are us, we are them. All right? We have to figure out a way to be able to get more housing of this type so that people can get off the streets, get out of the shelters, move on. Yep. The continuum of care system performance. This is data analysis of our permanent supportive housing programs. And you can see here, we served 4,251 people, 1,989 persons served with disabling conditions. This I don't think is an unduplicated number, so it's probably, this is deduplicated. And then we have 960 veterans that we served over the year. 226 of 363 exited to permanent housing. We only put 363 because that were just the number of exits that we had total. So you can see we have a 62% rate of exiting to permanent housing. The question is, where are the other 38% going? You want to take one guess? Emergency shelter? To the streets? Probably. Okay. Exited with no income, 13%. That's pretty good. We could get that lower. But exited with one or more income sources, only 55%. What do you think happened to the other 45%? With no income, they exited to a housing situation. Well, you tell me what happens when you don't pay your rent. Tell me what happens when you don't pay your mortgage. You end up right back in the system again. We have to do a better job with this as well. Street outreach. They served a total of 1,946 people, exited to permanent housing destinations 19 out of 863, and I added this here, 153 of 863 exited to emergency shelter, transitional housing, or other housing destinations. Their referral success rate is only 20%, which means that we're losing people, is what it means. Typically, the highest other number here is unknown. We don't know what happened to them. And if you talk to street outreach workers, I was a street outreach worker myself, and generally there are only two conclusions that you come to when somebody exits your program. Either they're doing really, really good and you can't find them, or they're doing really, really bad and you can't find them. Okay? And so what I would argue is of that 80% that did not get referred, 40% of them might be doing really, really well, and 40% may be doing really, really poorly, which still puts us behind, because that means chances are we're going to see them again. Chances are they're going to show up somewhere else again a month from now, 2 months from now, 3 months from now, and we'll be providing the same services we did previously, and hopefully this time we'll be able to make them successful. The Homeless Management Information System. I put in a slide here to reference it because I know y'all are interested in this in particular, but I wanted to give you an update on our changes. We're making changes to our HMIS system. This week, on Monday as a matter of fact, we put out an RFP for 2 different systems, an HMIS system and a data warehouse. The way this will work, or the way we're envisioning this working, is that we will have a working HMIS system, and we will also have a working data warehouse. With this data warehouse in place, it will allow the HMIS system to share data or put data into the data warehouse, and any other community information system to put information into the data warehouse as well. Places like the courts, places like Parkland Hospital, places like any number of service providers who don't have the capacity to get onto HMIS. They'll be able to put their data into the data warehouse more easily, and then it won't compromise the integrity of the HMIS system or the integrity of the community information system that they are using themselves. Okay, does that make sense to everybody? Just one person nod, that's all just one. Okay, great, perfect, good. Our goals are with this to improve the data quality, improve the reporting capability, have both systems functioning effectively by January 1st, 2020. And that's a pretty short time frame if you know anything about data systems and transitioning over. But we're working on it, and we think it's possible. We have some good technical assistance from HUD, and they're telling us that they think we can make this happen. And it may even be sooner for those of you that are service providers that want to get into or use the HMIS system. It may even be sooner for that system, particularly depending on how we phase it out or how we bring it out. But at the very least, or at the very latest, January 1st, 2020, we hope to have 2 new working systems to collect data for our entire communities. Race and homelessness. Most of you are familiar with the SPARK initiative. I wanted to bring it up again and give you some updates on it. The SPARK initiative is supporting partnerships for anti-racist communities. Dallas partnered in October 2016. We got a grant from the United Way Fund. We partnered with 7 to 8 other communities in various stages of the initiative throughout the country. And they published phase 1 findings in March of 2018. Interestingly enough, HUD now expects all communities to address these issues. I was in Jacksonville, Florida. Those of you who have heard my story already, prior to coming here, I was in Jacksonville, Florida. It just so happened that the last notice of funding availability, the big HUD application that goes out, came out when I was still in Jacksonville. And I was reading through the notice of funding availability, and sure enough, I ran into the race section where you have to address what you're doing to address racial inequities in your system. And I said, what? I said, hold on, they can't score us for that because we didn't get to be part of the SPARK initiative. And I had just heard about that through Dallas and said, are you kidding me? So they already get more points than we do on our application because they're ahead of us. And so now HUD has made it mandatory for everybody to score themselves on this specific piece, and we're already ahead of it. We've already gone through phase 1. The National C4 SPARK report showed that there were 2/3 of people experiencing homelessness in SPARK communities were black. Poverty alone did not explain the inequity, as the proportion of black individuals experiencing homelessness exceeded their proportion living in deep poverty. And we'll see some specifics in just a second. Oral histories from study identified major system areas of focus regarding racial inequity, and you see the different systems that need to be updated. Right. They said a lack of economic capital within social networks precipitates homelessness for many people of color. That was a specific quote from their report. Pathways into homelessness, network impoverishment, family destabilization, intimate partner violence, and health. These are all the same pathways that we see for the entire population. If you look at the statistics, and these are again for the SPARK cities in their initial report, they found that the black population of those cities was 18.7%. Black population that they claimed was in deep poverty was only 30.7%, but the black population experiencing homelessness was 66%, almost double the number of people who are living in poverty in the general population. Okay. Some of the recommendations that they had was to design equitable coordinated entry and access systems, incorporate racial equity into grant-making decisions, data analysis, support higher racial equity within organizational development, and innovative health strategies to meet the needs of communities of color. So now on to what we've done. This was adopted by the MDHA COC board back in June of 2018. There is an inequity in access to housing and services because of things like racism and homophobia in the system. The goals were to implement the SPARK recommendations, align demographics of the homeless population to the general population, and create minimum standards in continuum of care rankings. So phase 2, that's where we're getting ready to go now. So this is what we're doing. On national level, we're meeting monthly with a collaborative that's been created. We have a racial equity plan of action with Dallas Truth, Racial Healing and Transformation, United Way of Metro Dallas, Spark, Faith Forward Dallas, and at Thanksgiving Square. They're our lead community partners. We've just received a $30,000 grant from United Way, again, to fund the support of this work. Thank you, United Way. And Nissy New, Director, Strong Nonprofits, United Way Metropolitan Dallas, is chairing the steering committee to keep this on track. So you'll be hearing from this committee soon, working forward. It's time to implement what the Spark recommendations have been. Feedback from the community. Another part of the analysis is we went out to the community. I had my staff actually go out and talk with individuals. And these are what they said. These are some of the things. We did 102 surveys recently in emergency shelters. 81% of the people said that housing is their first need. And if you've ever talked with someone in a homeless service provider network, you don't always get that as your first response from people, but people know they've been homeless enough that they know that they need to be housed. When asked what they would do to help themselves, they said things like, live anywhere housing is available. They don't care. They'll live anywhere. They just want a house. Get employment to help their situation. They want to be employed. They know that it's a barrier to keeping them homeless. Follow case management advice. And I know the case managers in the room are all shaking their heads saying, we knew they wanted to do this, right? Didn't y'all? Exactly. But this is what they said. This is what they told us. Okay? This is what they told us. Some of their open comments were, there's got to be a better way for low-income people to afford housing other than to wait for a government subsidy. This person doesn't want to wait for a government subsidy. They want housing that they can afford to be able to go out and find housing. I would like to see a quicker response to getting housing. You think? Getting the runaround from agencies about getting housing. Nobody's helping me because I don't have any income. Right? And we go back to our prioritization list and where the housing beds are. Housing beds are only available for people who are disabled or have income to get into them. I wish employment services were immediate. I want employment service requests honored immediately. In other words, they want to be employed faster. They know that it's a way to be able to get out of homelessness. More housing options for people who are ready to work. You can see what they're saying. They need housing and they want to work. I want more housing opportunities for non-disabled people and assistance in getting housing. Non-disabled individuals. Look, when I was a street outreach worker, when I was a case manager, we would go and talk to our clients and they know what the system looks like. They know what's wrong with the system. They can tell us what's wrong with the system. They're telling us very clearly what's wrong with our system. They see that there's housing available, but it's not available for a significant portion of their population. And they know that. The agency survey, what I did is I took information from an agency survey that was done in October. And what they said, again, this is a system analysis overall, so I'm going to point the finger at us. What were the weaknesses of MDHA? Anybody want to guess what the first one was? HMIS, yay, homeless service providers. Oh, hold on, I'll get to it. HMIS, how about that? And guess what? We listened. How about that? We're trying to work on that one. Yay! Lack of clear system performance measures. They want to know how they're performing. Are we doing better or are we doing worse? You should not have to come to the State of Homeless address to hear how your system is performing. You should not. But I can tell you that a lot of you probably had no idea before today. We're guessing. You know how I know? Because people were calling me on the phone saying, Carl, what's our number? What's our number? Trying to bribe me and everything. No, just kidding. Didn't go quite that far, almost. Not showing progress towards ending homelessness. It's true. We're not. We, as the COC lead, as a continuum of care lead, are charged with that from Housing and Urban Development to end homelessness. That's our charge. And you saw what our mission and our vision is. It's about ending homelessness. And we are not moving in that direction. What are 3 weaknesses of the COC assembly? We have an assembly of all our providers that gets together on a regular basis. Inability to drive a system approach. So we've got to work more closely together. Lack of effectiveness of committees. Some of the committees literally, I think, died in the middle of last year. That's not effective. That's not going to help us. Unclear process to make change. They want change as well. These are the service providers saying this to us. We want change. We want to see something happening here. Overall, the community lacks quality data, strategic planning, and community standards to end homelessness, is what the task force that put together these surveys and put together this information came up with. This is what they told us. And honestly, from what I can see coming in here, and again, it was not a surprise to me, so y'all didn't trick me. I know some people, say that about going to Dallas. You got tricked, Carl. I said, no, I knew what I was getting into. They were very upfront. The search committee and Karen were very upfront with me, told me what was going on, and I could see from the data and the information what was happening. And this is what it looked like. So, I just want to do a quick recap, and then we're going to talk about where we go from here and some ideas I have that I think might work for getting us to ending homelessness. So first, what do we know? These are the things that we know, and again, we've gone over these things. But we know that there are 4,538 people who are homeless on any one night, sheltered and unsheltered. We know that overall homelessness is increasing, veteran homelessness is increasing, chronic homelessness is increasing. We know that homelessness is growing significantly in the ages 25 to 54. Non-disabled individuals and families don't have enough housing to meet their needs, and people are stuck in supportive housing due to the scarcity of safe, affordable, and accessible housing. One of the reasons that the performance system that I showed you had such a large number for the need for permanent supportive housing is because nobody is moving out of it. And again, like Carl, it says permanent in the word. Yeah, it's not really supposed to be permanent. You're supposed to graduate. Someone once said to me, or once told me at I think it was at a seminar, somebody said, why should we sentence someone to a lifetime of case management? Why should we do that? We shouldn't. Some people need it. Yes, we understand that. But for those that don't, there are a lot of people in our permanent supportive housing units right now that are sitting there only because they cannot afford housing. They don't need the services. Their case manager might visit them once a month just to check in and see how they're doing. But they don't need the services. They just need a subsidy or need some affordable housing. That's what they need. And we've got to figure out a way to move them through. Because there are a lot of people on the streets that need that case management, that need those support services, that need that wraparound. And we're not getting to them. They're staying out there because there's nowhere for them to go. We backed up our system. We also know the homeless response system needs to be more data-driven and more systematically structured. That's why we're changing or we're moving. We're doing an RFP for HMIS and we're trying to get a data warehouse in place. We know we've got to collect better data and we've got to drive our results based off of that. Rapid rehousing is significantly underutilized as a tool to end homelessness in our community. If you talk to communities across the country, they will tell you, most of them, that where they have rapid rehousing, that it's the #1 reason why their homeless numbers are going down. It's the #1 reason. It's the least expensive option and the most effective for the population that they're trying to serve. It really is. The funding sources to address the demand are either static or decreasing. Household incomes must increase. We have to figure out a way to get household incomes up. Safe, affordable, accessible housing must be made available. It's time for the community to rally toward one single vision for ending homelessness. And we're going to talk about that in just one second. Let me give you, at this time, everybody has a note card that was placed on your chair, and whether you were told or not, those are for questions that you may have about the presentation. I'm going to take a limited number of questions once we finish, depending on how much time we have left. So if you have a question, please write it down on that index card. I'm going to go through our system analysis, our strategy, or my strategy vision real quick. But at the end of it, when I get done, then I'm going to entertain questions. David will be back here. He will select the questions. I think we have 2 people designated to come around and collect the questions. So as you get questions done, if you pass them to the end of the row, they'll just come by and they'll pick up any questions that you have about the presentations. All right? I'm going to keep going while they do that collection. All right, so strategic planning. So we have a pretty good indication of what's wrong. We have a pretty good indication of what our system looks like. Now it's just a matter of what should we do about it, okay? Now this is Carl. This is my portion of the presentation, and if anybody else wants to take credit for it, that's fantastic. They can, but I'm just letting you know that if you're going to be mad at anybody about any of this part of it, that's me. And I'm okay. I'm a big boy. I can handle it. All right? But this is what I would do if I were trying to end homelessness in Dallas and Collin County, which, by the way, I am trying to end homelessness in Dallas and Collin County. So this is what I would do. This is what I would suggest. This is my proposal to the community. Okay? There's nothing in stone here. I've put a little glitz and glamour on it, so don't, ooh and ah too much or anything, but I just want you to know that this is my vision. First, let me say the COC leadership, like many other organizations or several other organizations in the community, held a leadership and strategic planning retreat where we developed our own strategic plan. It was held last March right here in Dallas. We had 11 national leaders come in. There were 65 local homeless response leaders that were invited. We learned about the homeless response system strategies, helped everybody understand their specific roles, worked on how to apply corporate process strategies, and developed a 3-year plan. Now, my understanding, again, before coming to Dallas, is that there were multiple strategic plans for ending homelessness. That's fantastic. So what I did, of course, is I think David has this as a saying, you cheat from the smart kid, right? So I took all of the strategic plans that I could find, every single strategic plan and every thought that somebody scribbled on the back of a napkin from Dallas and Collin County, and tried to put them all together, okay? Because they're not that different from each other. Ending homelessness is not like, 2 different worlds or something like this. There are a limited number of solutions that we have for this, okay? So I put them together, and I call it the D1 plan, okay? And these are the stars: housing, resources, support systems, training, data. If we consolidated all of our strategic plans to end homelessness, this is what it might look like, all right? And I put a star up there. So you all have to love it, right? Isn't it? This is Texas, right? Yay! Well, see, I'm learning. I've only been here 4 months, Daniel, but I'm learning, right? I'm learning. Anyway, that was actually my wife's idea, so I can't take credit for that one. All right, so what does it look like? If we drill down into it a little bit, here are some of the things that I think we should be working on in the different areas. Now, I have not given assignments or said who should be responsible for any of these things, but you'll notice that some of them go right along with other strategic plans that you've already seen. Number 1, implement track 1, 3, and 4 from the Office of Homeless Solutions. What? They had a plan. And I think it's a good plan in those sections. Let's implement those things. That's fantastic. Let's do that. Okay? See, that's easy. Develop a move on pilot to open permanent supportive housing units. A move on pilot or move on vouchers or move on systems is where you take people who are doing really, really well in your permanent supportive housing or your long-term housing units, even in rapid rehousing long-term. You take people who are doing really well and you give them the vouchers that become available in any community. And I know we've had a struggle getting vouchers, and I've talked with DHA about this, and I've posed it to them, and I've told them that this might be a different solution than what they've tried in the past and might actually help them in the community as well. I think they were positive about it, but again, we have to keep the dialogue going. But this is what I would do, is I would develop a move-on pilot and see how it works, okay? I would increase rapid rehousing units, and I'm not even going to go into how to do that yet because that's a little more controversial, but we'll get to that, okay? But we have to increase the rapid rehousing units, there's no doubt about it. Build more mixed income, mixed use housing. City Walk. City Walk is a great example of mixed use, mixed income housing, where they have market rate units and they have affordable housing units, and one supports the other. That's a great example of what happens. Yes? Great example? Yes, it is. It's a great example because it sustains itself. You don't have to worry about something else trying to sustain it. It's a fantastic example, and I think it would work well in a lot of the communities around here. Okay? Data. We need to improve our HMIS system. That one I am working on. We are working on. My staff at MDHA are doing a fantastic job with the RFP, and we think we're going to get some really, really good HMIS system vendors who can make that happen. We're going to add the data warehouse. We need to create clear community performance measures. That's going to have to be outside of the continuum. That's going to have to be everybody agreeing that there are performance measures that each component should live up to for our community. Okay? And then we need to create status reports for the community. Look, I love coming here and getting all the attention and standing here in front of hundreds of people and talking. This is going to be fantastic every year. Love the idea. But I want you to already know what's happening throughout the year. I don't want you to wait until March to figure out, oh, you know what, it's not working. No. What I would like to do is get to monthly reports that we send out to the community that show the community where we're making progress and where we're not making progress. And then build on that each month, make changes to things and do things differently. Okay? Support systems. Implement the SPARK suggestions. I think we're well on our way to doing that. I think we have a good partnership and a good group of people who are really committed and passionate about that. Increase integration of behavioral and medical health into housing. We have to figure out better ways to do that. I was at a meeting recently with MetroCare and Molina Healthcare, and they're very interested in doing things like that. So I think there's an opportunity there for us to add those kinds of services. Improve diversion and outreach efforts. We have to do a better job in these two categories. Okay, we have to do. The Family Gateway, the Family Gateway slides that I showed shows that it works. It works. If you do diversion well, it works. And I think we can replicate that model at a lot of our organizations. Okay? Resources. Research a funders collaborative. Getting funders to come together around this issue. Okay? We have lots of funders, and that's fantastic for our community. We have lots of resources. But having a concerted effort, having a really concentrated effort could make a huge difference in what we're trying to do. Then instead of getting, $1,000 to help one person move into housing, we might be able to collaborate, put it together, and get $1 million to move 1,000 people in. That's how you make real, huge system changes. Okay? Research the pay for success model. There are models out there now called social investment funds or social investment bonds, where you get private investors to invest in your community around homeless solutions. And then if it saves money to other organizations, hospitals or jails or other institutions, then they get their investment back. And then they can reinvest in something else. And it just keeps going and keeps going and keeps going. That's a pay-for-success model. And they're very successful. We don't have anything like that here. Okay? Blend public and private resources to increase effectiveness. We've got to bring together those resources. Again, I saw something, and I don't know who the developer was, but there's a developer that's using low-income housing tax credits to build affordable housing and they're actually doing mixed income housing downtown in Dallas. That's a fantastic model. But from what I understand, they're trying to get together private and public funds and blending those things. That's great. That's fantastic. That's what we should be doing. Training. We need to learn evidence-based practices and innovative strategies. I know, as soon as I got to Dallas, everybody told me here that Dallas was the best, and Dallas did the best of everything. But I want to let you know a little secret. It's not necessarily true with everything. There are good models in the rest of the country that I think could work here very, very well. And I think we need to bring some of those models here. We need to research them, we need to bring them here. And we need to get trained on how we do it. Ensure all populations have equal and fair access to services. Again, this goes back to the training about racial equity or inequity. And also develop trauma-informed systems. Our people are traumatized in our systems. And sometimes that's what's holding them back. That's what the barrier is to them getting into housing or keeping that housing, is we've got to figure out a way to be more trauma-informed. And provide programs with tools to change and become more effective. So we have to be able to get these to the people who need them, who want to make changes to their systems. Because again, if our system stays the way it is, what do you think our percentage increase will be next year? Anybody want to guess? Of homeless individuals? 9% probably, right? We're headed in that same direction. If we keep doing the same thing, we're going to get the same result. So people are going to have to agree that we have to change things, which means some providers might have to change some of the things they're doing. All right? But we need to train them. We need to give them the capability to be able to do this. All right. I like this quote from Henry Ford. I was trying to think of how other agencies or other communities really kind of started to end homelessness. And I thought about the communities I've been in that have lowered the number of homeless individuals in their population every single year. And I thought, well, what were they doing differently than what we're doing here? And ultimately, what struck me was, again, this saying: if everyone is moving forward together, then success will take care of itself. Sure, they had goals, they had targets, they had all these things, but ultimately, what it came down to is that everybody in the community agreed that they were all going to try the same thing together. They were all going to move in the same direction together. That they were tired of where they were, and they wanted to do something about the problem. And at the end of the day, most of the time, we had forgotten what the goal was, honestly. Because we were all just working together. We were just trying as hard as we could, and then at the end, we would go ahead and measure it. But what we found is that success or homelessness went down in just about every one of those situations. We've got to be working together. Got to be moving forward. System change begins with you. So this is my ask of everyone in this room as an individual. Okay? I want you to think of one action that you can take in the next 48 hours. Behaviorists say the hardest thing about change is making that first change. So just one small thing that you can do, the tiniest, smallest thing. And again, to give you some prompts, think of it as the T's: your time, your talent, your treasure. Something above and beyond what you would normally be doing in the next 48 hours that you can do to help end homelessness here in our community. All right? And I'm going to ask you to do that, to start that process, to make that change. Right? And since I have to lead by example, that's why I'm here, I'm going to start by donating $1,000 to a COC homeless service provider in the next 48 hours, not named MDHA. Okay? And yeah, there you go. Okay? And it's okay. Daniel, I checked with my wife. She said it was okay. So I'm good in that regard. So that's what I'm going to do. I figure I give my time and I give my talent, but this is going to be my personal treasure to give in the next 48 hours. That's above and beyond what I would normally do. Okay? The question is, what will you do? That's the question. What will you do? Finally, I want everybody to know that even though we're in the situation that we're in, it can be done. Okay? And that's another reason why I picked D1. Because it can be done. I'm done managing homelessness. I told this to the search committee when they asked why I was coming here. And I said, I'm done managing homelessness. If that's who you're looking for, someone to come here and manage your problem, I'm not the guy. I'm done hearing that Houston is the only city in Texas that does anything about homelessness. Right? Have y'all heard this? It's all. I've only been here 4 months. I was talking with David about this slide. And he said, Carl, you've only been here 4 months. Imagine what we've been going through for years. And I said, how is Houston better than Dallas? How are they? It's not. It's not. We can do this. But I'm tired of hearing whenever somebody says, and again, we see this at national conferences, you run into somebody and somebody says, oh, do you know the people in Houston? What? Am I invisible here? No. We have to work together and we can do this. I'm done hearing that we can't end homelessness. That's what I'm doing, is I'm here to end homelessness. Okay? I'm done stepping over people on the sidewalks. I did that for the point in time count. And I'm done. That's wrong. There should not be people sleeping on the sidewalks. And I'm done talking about what to do to end homelessness. It's time to do it. Okay? This is my call to action to you. All right? No more talking, no more scheming, no more planning. Look, we can do all those things, but we have to have some action. We have to do something. We are at the point now, 2 years in a row, where homelessness has gone up 9% each year. Next year, it will not be up. That is my guarantee to you all. It will not increase next year. It will not. Okay? Not on my watch. Not while we're here. Right? Thank you. Now let's get to the questions, David.
Grab the mic and I'll read them.
Okay. Fantastic.
Okay. Not everybody's handwriting is as beautiful as yours. Okay, so given what we know, and we have had prior knowledge of this fact, why aren't there more rapid rehousing providers in our COC?
That one is pretty easy, actually. That's a pretty easy question to answer. Why aren't there more rapid rehousing providers in the community? Because we have not funded it. I think what happened with Dallas, and it has happened in some communities I've seen, is Dallas got tricked by the shiny object. Okay? HUD came out with this idea years ago about permanent supportive housing and prioritization and serving the hardest to serve and all these kinds of things. And they said, look, if you do this, then your homeless situation will be okay. And Dallas said, we're all in. We will fund permanent supportive housing. You saw the numbers. We will fund permanent supportive housing and we'll put all our dollars and we'll put all our resources in that basket. And then what happened? It didn't solve the problem. What other communities saw is they said, well, HUD might think that's a good idea, and we'll fund permanent supportive housing. But what the statistics show us is that you have to have a blend of rapid rehousing as well. because there's this whole other population of people that you're just going to be leaving out on the streets or in the shelters if you only fund permanent supportive housing. And so they switched it. Other communities switched it, and they started funding in proportion to each other, rapid rehousing and permanent supportive housing. We've got to do that. We've got to change that. So I don't think it was anybody's fault here, because that's what HUD told you to do. What I'm telling you is you can't always believe what HUD says. I know. Can't always believe everything HUD says. But what I'm saying is that's what I've seen in other communities. So that's how I think we got where we are.
So this is almost like a follow-up question, but it's also about rapid rehousing. So it says rapid rehousing needs to exist in an environment where affordable housing is scarce. Can MDHA take a role in linking landlords with an affinity to help homeless citizens in shelters?
Absolutely.
Or to shelters?
Yes, absolutely. And there are people getting housed in our system, and I showed that. Our HPL is housing people. Imagine how much better landlords would receive us, though, if instead of coming to them with people who have no income, we came to them with people who had income. Generally, they're more receptive to that, or at least that's what I've seen. Okay? And people who are willing to work, and people who are willing to pay a little bit more for their rent. Okay? Those types of things. Case managers love that. To get somebody who has income or who is working to work with, that's a case manager's dream. Okay? Because they're used to seeing people with no income whatsoever. So I think there are housing units there to be had. I think we have to figure out how to get them, how to expand on getting them, but also we have to build some of them, and that's where that mixed use housing comes in. I think we could do that. Anyway.
So this is about kind of affordable housing, so again, kind of related. Of all the new developments going up, it says here like along Ross, what percentage of each development is required to be left for affordable housing? Many of the developments have displaced affordable housing spaces.
That's correct. The best research I saw was done by a city planner in New York who said that if you want to end homelessness, that you will develop 20% of your units, of all the units in your city, at affordable rates. I haven't done an analysis yet, so I don't know where we're at with that, but I would guess we're not at 20%. But if we started building mixed income units or mixed income buildings, and we at least included 20% of them in that makeup, I think it would go a long way towards helping us. So, does that answer the question? Sorry. Pretty good, okay.
So they're clearly taking notes. So this is about system cost analysis. Emergency shelter percentage of spending was at 49%, and you described that as potentially, well, you didn't describe it as potentially, you described it as a poor return on investment. But in an environment where rapid rehousing is minimal, short-term or permanent supportive housing beds aren't really available that much, what's a homeless person to do?
Well, I think that's where we have to look at where the investments are, and maybe we have to change some of those investment strategies. Is that if we move some of the dollars, and that's one of the things Ellen with Family Gateway has been very interested in, and she's seen results from this. If she changes some of the dollars or uses some of the dollars differently for things like rapid rehousing, she could move 4 people in, again, using the rapid rehousing model. If you use short term, you could potentially move 4 people in a year for what it costs to house or to keep somebody in shelter for almost the same amount of money. Okay, 4. So. And that to me is a good return on investment, moving 4 people in for a very minimal amount of dollars.
Yes, it does. So this question goes as follows, and this actually relates to something you talked about recently, so you may want to tell your story about your friend John that we've written about. Did your survey attempt to discern how many chronically homeless individuals actively reject, those words are underlined, actively reject attempts to provide housing?
I guess I'll tell my story as what I believe, and this is what I've seen, and this is doing street outreach. So, well, two things. Number one, when I was doing street outreach, I used to hear people tell me to my face, Carl, I don't want any of your services. Don't want anything that you have to offer me. And so, as a budding psychologist, by that I mean I had a bachelor's degree in psychology, I was fresh out of school, so I knew everything about psychology. I developed my own little survey or my own little test. And I created a one-question survey for people. And I said to them, whenever they would say that to me as a street outreach worker, I would say to them, I would say, so, if I could give you the keys to any house anywhere in the world, and you just have to move in there with no expectations of anything else that you had to do, you wouldn't take the key? And out of thousands, and I do mean thousands, of people that I talked to, only one person ever said no, they would not take the key. Only one person. And he was actually a train rider. And he was very honest, and he said, Carl, he said, I'm riding the trains. He said, I like riding the trains. He said, I'll come back for that offer later. He said, but every other person said yes. What they were really saying to me is, Carl, we don't believe you can make it happen. And my friend, John, who David so eloquently wrote about, thank you, David. For those of you who haven't heard the story, I talked with my friend, and he was a homeless individual who had been on the streets for a long, long time. And I said, so why is it that people say they don't want housing? And he said, well, Carl, he said, when you get up in the morning and you're a homeless person and you're out on the streets and you're in a bad situation, the first thing you say to yourself is, I'm going to get out of this situation today. I'm going to do it. Okay, great. You go, you try to sign up for this, you try to sign up for that, you try and get services, and at the end of the day, a lot of times you're still in the same situation. So the next day you wake up and you say to yourself, you know what, I'm going to do it. I'm going to get out of this situation today. And that goes by day after day after day after day, and it starts to wear in your psyche. And what he said is one day you get up and you don't think that way anymore. What you think is this: I have two options. I can either own this as my fault and nobody can help me, or I can kill myself. Those are my two options that I have available to me. He said, so that's what people are telling you, is they're telling you that they've given up on what you have to offer them. They've lost hope when they say that they don't want anything from you. And you've got to get through that barrier. And as a street outreach worker, what I would say to them is just give me one chance. One chance. Why? Because you haven't worked with me. You've worked with other people. You've worked with other systems, but you haven't worked with me. Just give me one opportunity. That's all I ask for to get you into housing. And a lot of the times it worked, because you've got to overcome that hopelessness. And basically what he was saying is, I'm hopeless now. There's nothing you can do for me. When that's not true. That's not true. We just have to try harder. We have to work harder for people. Okay?
So final question, and I find this very interesting because depending on where you want to go with this, it could potentially give Dallas an out. And I don't think we want to do that. But there's something in the background here. So is economic development / gentrification also causing increase in homelessness?
Yes. And again, if we let it, that's the first thing. That's the first answer. If we let it, we're part of the community too. Okay? You saw Karen, so eloquently in her speaking today, tried to recognize people who are running for mayor and running for city council. We elect those people. We have a vote just like everyone else. Okay? So the people that we put in positions determine the policies that we get back. And so sometimes policy change can be not as simple as that, but it can have implications for that. But In most of the cases, what I've seen, and I have dealt with gentrification as well, I've dealt with NIMBY, I went through a whole scenario, and actually a worse scenario than what Salvation Army just went through with rezoning their shelter. We were trying to get we were trying to get permanent housing built for disabled veterans, and the neighbors would not allow it. Disabled veterans in their community. And you should have seen the place they were defending. It was a crack house, and that's a good description of it. I mean, that's a positive description of it. Okay? But they were defending it because they didn't know or didn't want to change what was there. And so, yes, we have to make differences there. We have to make changes there. Gentrification can have an impact on what we're trying to do, but I have not seen it to the level where it actually impacts ending homelessness. There's lots of gentrification going on where I came from. There's lots of gentrification going on, and we still were decreasing homelessness every single year. We were ending veteran homelessness. We were getting close to ending chronic homelessness. We were doing it. So despite that, we were doing it. It can make it harder, but I would say it's just a barrier like anything else. All right. Thank you very much. That's all I have. Thank you all for coming. I appreciate it. Please make sure you do your part. 48 hours. You have 48 hours to do something. Thank you.